Hello, welcome back. The topic today is viruses causing jaundice. There are hepatitis A, B, C, D and E. There are 5 viruses, and hepatitis B and C, most of us would have heard about that, and they are the little serious one. And hepatitis A is the commonest virus that causes jaundice. That usually happens during the summer time, and that is where the native medicine, people give the native medicine. Usually it is a self-limiting disease, even without any medication that can easily get treated. But it can very rarely lead to a serious infection, and it usually happens through fecal-oral route. That means through a contaminated water or an unhygienic environment, especially through the fecal matter. So the unhygienic practices that can cause hepatitis A, and usually it's self-limiting. And hepatitis B is a little serious infection, and that is usually spreads through blood and blood products or any body fluids like semen, and through the sexual activity or through injections or any surgery where contaminated instrument is used, that can cause hepatitis B. It could be acute one, or even it could be chronic. The chronic one leads to liver cirrhosis and liver cancer. And hepatitis C, again, is like hepatitis B, through blood and blood products or body fluids like semen, or it usually spreads through blood transfusion, sexual activity, or contaminated usage of contaminated instruments for the surgery or any procedure. And again, it could lead to a chronic infection and can cause cirrhosis and cancer. And then comes hepatitis D. Usually this happens, people are already infected with hepatitis B. It cannot de novo cause infection, but it can cause a secondary infection where the hepatitis B is already present. Again, it could be acute or chronic one, but usually it's self-limited one. And then hepatitis E. Again, hepatitis E is almost equal to hepatitis A, where it spreads through water or fecal-oral route, where the unhygienic condition is there. And that is why we always say drink disinfected water. And almost all the viruses except hepatitis C has a vaccine. So the vaccine can protect against all the viruses except hepatitis C. And hepatitis B and C, most of the time they need antiviral treatment followed by follow-up, and probably they may require other treatments according to their symptoms. And most of these viruses, all the 5 viruses, can be easily preventable by boiling the water. Drinking water should be boiled, and safe hygienic practices can prevent all these viruses. Thank you.